Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene. And really just to support you on your journey through the dental hygiene program. It's really great to have you with me. And I have a special guest today. She is on her spring break, taking some time to speak with me, to connect with all of you. Her name is Suzanne Vila, and she is a remarkable educator. We've been chatting here, and I just love everything she shares with me. And there's never enough time in one podcast to say it all. So welcome, Suzanne.
Hi, Billy. Thanks for having me. I'm really excited about this.
Yeah, so I think we should just jump right in and you can just briefly share about your journey on become a hygienist and becoming an educator.
Sure. So, my journey into being a hygienist started several decades ago. Got to college. I wasn't quite sure what I wanted to do, and dental hygiene was one of those things. But where I was going to college, they didn't have a dental hygiene program. So, I started just with my gen eds and was thinking about it. Decided to apply to hygiene school, which was very competitive and still is. So, I told myself I would apply one time. If I got into the program, great. If I didn't, I was going to stay at the college, major in English, write mystery novels, and buy a dachshund, actually. Things that I was going to do to make myself feel better about not getting into hygiene school. But I did get into hygiene school. And since then, I've enjoyed a 30-year career, mostly in private periodontal practice, and enjoyed every moment of it. I've said more times than I can count that there's never a day that I walk out of the office and say, I never want to see a molar again. I just, you have ups and downs with days and different things that happen, but I've never regretted once the choice of dental hygiene. Although I still like mystery novels and mystery movies and things like that.
So you got accepted into dental hygiene school, and so becoming an educator is probably like a full circle moment. Tell me the difference between what it was like as a student looking at the educators and then what it was like when you walked in there as an educator.
When I went to hygiene school, I was truly terrified of my instructors. And I really think it was my own perception. They never did anything that was, mean or spiteful or anything like that. But it's very, very intimidating. So when I became an educator myself, I really wanted to be the kind of educator that was not intimidating, but helpful, that I want to hold my students accountable and make sure that they're doing the work that they need to, but that I'm kind of like their facilitator of learning, their coach, so to speak. And if something doesn't work out right, or they don't pass an assessment, they don't think all hope is lost, that their time with me gives them something that they can take with them to be better next time. And that they look at me as someone who wants them to succeed, not someone who's looking to fail them, basically.
That's a really good point. I do think that sometimes, and we all do this, maybe because it's so hard to gain acceptance that once you get in, you feel like, oh my gosh, I can't mess this up. I can't make one mistake, or I'm done, and that's the end. How wonderful for you to recognize that and then be very intentional to put some things together to build a bridge with the students. That's really great.
Thank you. Well, it's funny that you mentioned that, because when I was in hygiene school, I actually failed my first clinical patient. It was an infection control breach. It was a big one. Back in those days, we had physical charts. And when I was finished with the patient, and this is going to make you gasp, Billy, I put the dirty gloves on the chart. I put the soiled gloves, I took them off and threw them, and they landed on the chart. Big fat 0 that I got on this patient. And at the time, I was devastated. I thought I was going to fail out of the program. I didn't, obviously, but I share that story with my students when they're not successful with me with an assessment, because number one, I say, obviously I didn't fail out because I'm here and I'm now a teacher, but I learned something from it. I learned, what I needed to do, what not to do. And I never made that mistake again, not even in private practice. I think I've been very hyper aware of infection control because of that. that's my story that I share with students a lot. I do think it makes them feel better when they're not super successful in a clinical assessment, especially.
Well, it lets them know that you're human and that it's okay to fail something, to be
Mhm.
imperfect, and it's not the end of the world. And boy, do we learn a
Right.
lot more from our failures, don't we?
That is really, really true. I think sometimes when we fail, we have to dig a little bit deeper and do a little more self reflection, and kind of figure it out. And I think in hygiene school, especially, we have to learn as students have to learn how to kind of figure it out because the instructors, we're here to facilitate the learning, but the students, they have to be the learners. They're only with us for a couple of years and then they become our colleagues, and so they go from sometimes not knowing anything about dentistry to in a short, maybe 2 years coming out and possibly working among us. So they have to be able to dig deep and figure out why isn't this working kind of a thing, and I want to be there for my students to guide them through that, to kind of be like the coach saying you can, you can, you can, but ultimately they have to figure it out, what works and what doesn't.
Yeah, being a dental hygiene educator is definitely in alignment with being a coach because you're teaching them not just didactic information, but also clinical practice. You and I talked
Mhm.
earlier about this, and I just love some of the things that you do to help students along the path of doing that. It's really great. And I know you teach perio, so tell me a little bit more about that.
Yeah, so I was so glad that I was invited to teach periodontics in the program because I've had such a long career in clinical practice in private periodontal practice for 27 of my 30 years. So I've learned a lot along the way about clinical practice, but I think I've learned even more about how to communicate with my patients and how to establish relationships with my patients. So I try to bring some of that into the classroom too. My students are, they're in clinic seeing patients, doing assessments, perio assessments, coming up with their hygiene diagnosis. And then they see me at the end of the week. We meet on Fridays. And the first thing I say to the students is, how did the week go? How was clinic this week? And sometimes I get a little feedback and I'm in clinic. So I kind of know some of the things that are going on. And then I try to relate what they did that week into what our lesson's going to be. So we have actually a mutual decision making lesson coming up, where we're going to talk about that. And so just different things that I try to bring into that. I try to sometimes bring a little bit of humor into it as well, because sometimes our topics can be a little heavy. So I try to make it interesting because if all I'm doing is just telling them what the book is saying and things like that, they're going to be fed a lot of information, but it may not always resonate, be able to be carried over into the clinical piece. So I try to do that.
Yeah, I love that you ask them about their clinical experiences because a student may have had something occur in clinic that week that is directly related to what you're about to speak on in the classroom, and it will help them kind of make it understandable, relevant, and relatable so that they remember. Those are all the R's we're looking for, right? I
Mm-hmm,
love that.
mm-hmm.
I love that.
Yeah, I always tell them that, and I'll circle back to my love for like mystery novels and mystery movies and things. And I tell them the story that if I didn't get into hygiene school, I was going to be, a mystery author like Agatha Christie. And I say, but it's okay because even though I got into hygiene school and I never became a mystery novelist, I feel like I'm solving perio mysteries all the time, kind of call myself this perio sleuth, so to speak. And I tell them that, perio is you have to have all the pieces of the puzzle to put the perio mystery together. And every patient's puzzle pieces are going to be different. And if you have a few puzzle pieces missing, you're going to miss solving that mystery for them. And we talk about what those pieces are. And we have our important pieces, the ones that we know about, Billy. We have our clinical assessments, our radiographic assessments, our medical dental history, oral hygiene assessments. But I think sometimes we forget that some of those pieces come from communicating with our patients and being a little bit curious about our patients as well. Not just oh, where are you going on vacation? It's a little deeper than that. So I like to ask a lot of open-ended questions with my patients. My undergrad degree, actually, veering off for a second, I do take these detours sometimes.
I love it.
Well, I was thinking about this. I think I've taken detours my entire professional career. So instead of going in one direction, I kind of go on these back roads. But I think what I try to do is communicate with my patients. And that is what made me want to get my bachelor's degree in communications, because I thought that that would enhance my ability to communicate with my patients, and then also maybe give me some new opportunities and fun things to do within the dental profession as well. But I think, gauging how your patient looks that day, kind of remembering your patients. I do think continuity of care is important, but asking more questions than the typical, questions that we ask, and kind of trying to gauge their why, and why they're there, not just to get my teeth cleaned, but why it's important to them to get their teeth cleaned. Then kind of tapping into some of those things. I know I listened to a few of your podcasts, and you had some other guests that talked about that too, finding the patient value, and then using that as a real huge piece for filling those puzzle pieces with communication, and getting to know what's important to that patient. So I think that seems to resonate as well with the students, because we, as educators, as myself, we have a certain list of criteria that the students are tasked to perform, and then put it together to solve that perio mystery, right? But then there's a few of those kind of hidden pieces, and it's helping them to find what those pieces are, I think, and individualize that per patient. That really makes the difference. And I think it makes them start to really like perio, because it's not the same, So yeah.
Yeah, I love that. What's interesting is I think it takes the pressure off students if we guide them by saying, just ask lots of questions and remain curious, because then they're not feeling like they have to have all the answers. It's a lot easier for them to come prepared with inquisitive questions to a patient. What are your patient's beliefs about their mouth, about the health of their body? What are the patient's attitudes? Like how are their behaviors related to what you're finding out in the assessment? And it takes the stress off of them a little bit, I think, when they realize that
Mm-hmm.
it's not about knowing all the information, it's about asking the questions, which brings us right back to your detective mindset and your mystery novels. I love that.
Yeah, there we are. Another thing that I tell my patients to try to take some of the pressure, or my students to try to take some of the pressure off, is when they get to clinic. And I've been telling them that, as I see them in the fall in their first semester, and then I see them in the spring for perio. And I say to them that when they get into clinic, they may feel nervous. They're being assessed, they're doing something new. But the bottom line is, they are coming in with so much more knowledge than their patients. So in that way, they should feel a little bit of confidence, like they're there, and the patients are looking to them for a bit of expertise, so to speak, and they can be the providers of that. And like you said, with asking the questions, being curious, getting to know those patients, what I just observe is my students, when they're doing that, they settle in. They
Yes.
enjoy the clinic sessions so much more than when they are just trying to go through A, B, C, D, and get it all done. I can see that happening. So I think that really is the key. I really do.
Yeah, that's really great information to share with our listeners. I mean, I don't know how many years it took me to figure that out, but probably way more. And then the other thing that I just wanted for you to share with students is Well, self-proclaimed queen of analogies. I would love for you to share a couple of your analogies with our students.
Yes, I am definitely the self-proclaimed queen of analogies. I've said that over the years to my patients when I was doing oral hygiene instruction and giving them information. But I try to use analogies, fun analogies, when I'm teaching my perio lessons, because as we know, there's a lot about perio that can be very difficult. When we're doing our lesson on microanatomy or immunology, at 9 o'clock in the morning, we need lots of coffee to get us through or something. So I try to use a little bit of humor and a lot of analogies to try to explain things. I think my two favorite ones are ones about host response. So I have a couple of those. The first one, I think all of my host response analogies actually center around going to a party or going to a club or something. And I tell them that the bacteria, they're kind of like the party crashers that show up and you don't want them to be there. And the bad bacteria, the super bad bacteria. We have good and bad bacteria, but they're at the party and they're hanging around and everything's kind of harmonious and there's no trouble. And then all of a sudden these bad guys come in and they're just crashing the party and they're just causing all kinds of chaos. And our immune system is like the security team at the party or at the club. And the first thing they do, I tell them, the first thing that they do is they send the PMNs in to like, hey, get out of here. You don't belong here, and they send these guys in there. And then if that doesn't work, then they bring in the bigger team. These are the bigger security guards that, okay, maybe we can't get them out, but we're going to keep them in one place of the club and try to, keep this under control. And so those are your monocytes and your macrophages, and they're just in there, just kind of keeping everything under control. But when they're doing that, there's still a little bit of chaos going on, but it's not this huge problem, right? And we can still kind of function, but there's still a little bit of chaos going on. And then I talk to them about when the host response is overzealous. And I say that's when the security team thinks that there are hundreds of party crashers coming in, but there's only like 3 or 4. And they come in and they are just, trying to push them all out. And as they're doing that, they're breaking stuff and they're pushing other people around who are just trying to be living their life at the get together, And so I try to do that and tell them in that way. And I get laughs. I really do. And then I'll say something like, I'm not sure why I love this party analogy, but I guess that's, me reliving my 20s or something, but it seems to resonate. They love it. They talk about it. Another analogy that I like to use, I think it's hard for students, especially new first year hygiene, when you talk about clinical attachment level or clinical attachment loss, biologic width, those types of things. I do use my hands a lot. I don't know if I told you that, but I use my hands a lot. But I also use an analogy that talks about me and my dog, because my dog loves me so much. So when we talk about CAL and biologic width, I always tell them like I'm the alveolar bone and my dog is the gingiva and we like to be together, but sometimes she's a little overzealous, she's a little over the top. So kind of think that is like pseudo pocketing. And then when we talk about biologic width, we like to be together, but I don't want her too close to me all the time. So if she tries to get too close to me, I'm going to pull away. But if she's too far away from me, I don't like that either. So she just needs to be about an arm's length leash, length. And that seems to work. So we talk about that too. And that it just gets a lot of laughs. They see pictures of my dogs. So, I think they can picture it. I don't know if I told you, but my students right now, I'm told, are keeping a running list of their favorite Mrs. Vila quotes. If you want to hear the one that I like, that I've heard, me. I don't know them all. And I laughed out loud when I was told this. And then I'm like, yeah, I've said this. I mean, I didn't plan to say it, but apparently, so my quote to them is, it's all about the CEJ, folks. The CEJ is everything. thinking maybe we could have like sweatshirts or merch or something created with that little Mrs. Villa. And I'm like, that is me. Because I can picture myself when I was told that. And I'm told there's a running list. So to be continued, when I'm told that that was one of the ones, and I'm like, I can see myself standing up there with the PowerPoint saying, it's all about the CEJ, folks. The CEJ is everything. And them just like, yep, that's Mrs. Villa. That is Mrs. Villa.
Oh, I love that. I definitely think you should have a running list of all of your. That's fantastic. You are providing such a valuable, innovative, creative way for students. It's so great for students to learn really complex things. And the other piece is they'll be able to have an example of a way to make it tangible for patients to understand. Because it's really hard for us to take all that stuff out of the textbook and have a really solid understanding ourselves of the complexity of periodontal disease, and then have a patient in our chair and try to help the patient understand just enough so that they can have some valuable understanding of why it's important to treat it. And sometimes it gets really muddy. So your examples are really great for everyone involved, the patient, the student, everybody involved. I love that.
Thank you. Yeah, I would love to know in the future what analogies my students will use, when explaining some of this to their patients. Like that would be great if they would get back to me, in a few years and say, oh, I'm using this analogy because of this. Or, I think you're right. I think the way that students or us as hygienists, the way that we explain periodontal disease to patients is super important because it has to be something that they understand. So we have to make it something that's in lay terms, but there's a fine line. And I tell my students this too, because we don't want to make it so simplistic that we're minimizing what's going on. And we also don't want to insult our patients. I tell them we don't want to be saying like, oh, there's a little problem here and we have to do this, because patients, I think, know more than we think they do. And I think that they value it more than sometimes we know they do. And so what I like to do is, tell them what's going on, use my analogies, and then start to incorporate some of the dental terms that we use. And some patients really appreciate that. And if they don't, you can put that to the side and still use those other analogies and things. So I do sprinkle a little bit of that into my lessons when we talk about patient communication. They may call it tartar, and that's okay. The patients, and you can say that during your OHI, but you can also tell them that we call it calculus, and they're both the same thing, or it says something like that. So I try to give them those little sprinkles of things that they can do.
Well, thank you for coming on and sharing all of this. You're just bringing so much value to the next generation of dental hygienists as they kind of are under your wing and learning all of the things that you've learned over the course of your journey. It's just wonderful, Suzanne. It's so great.
Thank you. Thank you so much. Thank you. And that's really, if we're circling back to my journey into teaching, I think that I knew that after 30 plus years, I was coming toward the end of my full-time clinical career. I realized education is a way that I can kind of give back to the profession and maybe hand over a few, ideas, pieces of wisdom that my students can take out there and just make this profession even better, than what we did.
Yeah, and that's all we can ever hope that we do. Well, I just want to
Absolutely.
say thank you for all that you're doing for students. Thank you for coming on. It was a wonderful conversation, and I really appreciated having you on.
Thank you so much, Billy. This was absolutely awesome. I really appreciate your time.
Okay, we'll talk again soon. Bye, everyone.